Hi, my name is Lakeisha Thompson, and I'm with Maryville University, the advanced practice. And I am here with my patient doing an advanced cardiovascular and lung assessment today. So we'll get started with the heart. We'll start with the inspection first. So at this point, I'm just looking to see if I can see any thrills or heaves, any type of masses, and that he's symmetrical anteriorly as well as laterally for his chest wall, and all of that looks correct. I'm also going to have him bend forward and just check to see if I can see his apical impulse, and I can, and it's right at the fifth intercostal left space mid-clavicular line, so you can sit up. And at this point, I'm going to go ahead and do a palpation. So with palpation, you're going to go ahead and palpate the apex of the heart. At the same time, I can also check his carotid pulse and make sure that they are in sync, and they are. I'm going to also check his left sternal border, as well as the base of his heart, and the right border. And again, I do not feel any thrills or any heaves or lifts at that time. And then we'll go to percussion. Normally with percussion, the best way to do percussion is actually not doing percussion, but getting an x-ray. That would show more definitive measurements of the heart, because actually there's many things that can throw off the size of the heart doing percussion. Even fluid around that area can throw off the size of the heart, so you're better off doing an x-ray. So we did that prior to this exam, and he did come back with a normal heart size. We're going to go ahead and go into auscultation of the heart sounds. And we'll start over on the aorta and listen to that. It's at the second intercostal space on the right sternal border. And now we'll listen to the pulmonic, and that's on the second intercostal space, left sternal border. Now I'm listening to Erb's point with the third intercostal space, left sternal border. And I'm listening to the tricuspid, which is the fourth intercostal space, left sternal border. And the mitral area, which is the fifth intercostal space, mid-clavicular line. And at the same time, this is when you could go ahead and check for pulse rate. And we would listen for a full minute, but for sake of time, we'll listen for 30 seconds. And he's right around 65. We would go ahead also, and just for sake, we will go ahead and have him lay down flat for me, and we will listen to his heart sounds again using the bell of the scope. This will also help us to listen to more of for murmurs, clicks. Take a nice deep breath for me. And if you can mention your neck that way for me. And I'm just looking and notating to see if he has any jugular venous distension, which he does not. You can go ahead and sit up for me. Okay, and now we will look at doing lungs. So currently, again, I'm going to start with the inspection step. We're going to look over and make sure that, he doesn't have any signs of stenosis around his mouth, that his coloring is intact, that he does look, normal skin color, if I can see your hands. I'm going to check actually to make sure that his cap refill is less than 3 seconds, which it is. And then I'll have you put both your hands together like this for me. I'm going to double check to make sure he doesn't have any clubbing, which he does not. And you can put your hands down for me. I'm also checking to make sure he doesn't have any nasal flaring, any retractions while he's breathing, and all looks within normal limits for breathing. So we're going to go ahead and start with the palpation. And so we'll go ahead and palpate his chest. Just tell me if you have any tenderness that you feel.
No, that was good.
Okay. So I'm checking for tenderness. I'm also checking to make sure he doesn't have any masses, any nodules, or anything like that, and it all feels just fine. We'll also go ahead to make sure he doesn't have any tactile fermentus. And then I will have you also start saying the word 99 for me.
99, 99, 99, 99, 99.
And he is positive for tactile fermentus. We're also going to double check the costal angle and just check for that. And when, which this is his costal angle here. This is his notch. Also, we have the Erb's point here and the manubrium. So just some of the landmarks as well. And then I'm going to have you, we're going to check some retractions. I'll have you kind of lean towards me this way. Or nope, turn you back towards me, sorry. And then we're just going to go ahead and check for, going ahead and doing some symmetrical here to just check breathing. You want to take a nice deep breath for me? And I'm just checking to make sure that both of my hands are actually going up correctly. And that's at the 10th rib. And that all looks good. Okay, thank you. And then we will start off with doing also now the percussion of the lungs. So we're going to check all the lung fields. I'm going to go ahead and just, if you want to, just. And I'm just checking for resonance. Then I'll have you lift your arms for me. Do your back first. Okay, and I'm going to do this last side here. Okay, resonance throughout all lung fields. So last, we're going to go ahead and just auscultate his lung sounds. Nice deep breath. I also didn't hear any audible wheezing or stridor. And of course you listen to each side for comparison. and they all sound, breath sounds are all equal bilaterally in all lobes, and I heard no adventitious lung sounds. Last, I'm going to go ahead and check for diaphragmatic excursion, and also while listening to his heart sounds, I listened to just S1, S2. There wasn't any gallops, clicks, any murmurs noted, so all normal heart sounds. So last is the diaphragmatic excursion. I'm basically just going to do some percussion to listen to when it starts to get a little dull here. So I'm going to have you go ahead and just take a nice deep breath for me. And I'm going to mark this spot. And then I'm going to go ahead and have you take a nice deep breath and let out all the air you can. And hold. And then we're going to do the same thing on the next side. I'm going to have you take a nice deep breath for me. And then again, nice deep breath, and then blow out all the air and hold. And then we will measure that, and it should be between 3 and 5 centimeters. And he is currently at 3. So that will conclude my advanced assessment of cardiac and respiratory. Thank you for watching.